we've been talking a lot about weight loss drugs like Ozempic, but some people are dealing with major complications after taking them. So Dr. Kohli is here to break it all down. Good to see you, Doc.
Dr. Kohli.
All right.
Hi, guys.
Hi.
Hi.
We have to talk about this because, you know, I'm a Bravo-holic, and this is really just all over the Bravo sphere. So New Jersey housewife Jennifer Fessler says her weight loss injections gave her an impacted bowel. Other reported complications include suicidal thoughts, burps that smell, and even losing teeth. So out of all these, what do you find the most concerning?
You know, the symptoms and the side effects of these medicines, as we're using more of them, are growing. And even doctors are just now learning all the different things that it can cause, including things like burps that smell and rotting teeth, because it can change the way that your saliva
Would that be part of the smell? Is the rotting teeth?
Well, it is, but it's also the stomach doesn't empty fully. So the food kind of sits and ferments in there.
So it's coming out.
Yeah, so when you burp, you can actually taste and sort of smell it. But more than the side effects, Erica, what I'm concerned about is the fact that we're using these medicines without educating the patients, the people that are using them, about what these signs are. Because she actually was having warnings that her bowel was impacting. And an impaction basically means like an obstruction. A piece of stool gets stuck, so things can't move along. And that can cause the bowel to sort of tear or rupture, which can be a life-threatening complication. So she was getting more and more constipated. She was getting obstipated, which means nothing's moving along, and she just didn't make much of it. So we have to remember, this is not just a beauty treatment. This is a medication, and it can have potentially life-threatening complications.
And to take those seriously.
Yeah.
Well, another celebrity said she tried to use Ozempic to help with her menopause symptoms. So is this wise to do?
This is becoming increasingly popular too, because what happens to our bodies during menopause? Our metabolism slows down, right? So 70% of women will gain weight during menopause. Sometimes we have mood swings, so we end up on antidepressants, which can also make us gain weight. So could we use these weight loss drugs to sort of counteract that weight gain and really, you know, reduce the medical risks associated with weight gain? So in theory, it's a brilliant idea, but the implementation is a little bit tricky here, because we know that these drugs can also affect our bone density. So when we lose weight with these drugs, we don't just lose fat, we're losing bone, we're losing muscle, and we're losing strength, which we know in menopause are all things that can get affected as well. So I like the idea of using them to counteract the medical risks, but I don't like the idea of using them just to make our bodies look the same, because we worry that people are going to judge us after menopause for gaining weight, or to use them in a way where we're not studying some of these possible side effects.
Okay, and Doc, I'm going to ask this question before I get to my real question. You know, you said something interesting when you said, you know, this isn't a beauty treatment, this is a medication, but I feel like it wasn't introduced to the public like that. It was introduced amongst us as like, hey, you can lose weight with this injection. So how does the medical community go about letting people know that this is a medication and it has side effects like any other medication? Because all I see is thin people on the commercials or people getting thinner.
You know, I was driving by the other day and I saw a medical spa that had a banner outside for this medication alongside the Botox banner. And I think it's penetrated our society in just that way, Al. And I think these types of conversations where we talk about side effects, and I like to applaud the celebrities that talk about their challenges with these medications, because I think that's how we're going to raise the public awareness. We in the medical community are very much trying to say, stay away from compounded pharmacies, stay away from, you know, preparations that people are saying you can get without a prescription or get from Canada or Mexico. Really, really remember, this is a medication that affects not just the gut, but every system in our body. So we have to be very careful with it.
Okay, well, that leads right to my next question about things that used to be recreational and now are looked at as medication. 1 in 8 seniors are using cannabis as a way to treat pain, insomnia, but, you know, they might not be well versed in what to do or how to use it. Do you see marijuana as a good outlet for kind of getting off of a pill or two or a couple medications and using that more medicinal plant to treat pain and insomnia and not anything else?
You want to keep going?
Are you speaking from personal experience here? So yes, but we need more research. Because of marijuana, its illegal status, we don't know much about it, even as doctors. For example, me as a cardiologist, we know it's linked to cardiac arrhythmias. And a lot of times when patients say, well, it helps with my anxiety, it helps with my sleep, but then they're triggering the arrhythmias with it. So in our senior population, it makes me even more nervous, because those people are prone to falls. What if it impairs their balance? What if it impairs their judgment? What if it impairs their risk of dementia or their memory problems that they may already already be having. So using it in those types of patients that are on a whole host of other medications that can interact is really tricky. So
can I ask a really quick question? For instance, Marinol, which is the pill form, it doesn't really get you high, but it's in hospitals. It can really jumpstart appetite inducements for people in cancer that are just not eating and fading away. Is that something that people could? I just want people to be aware there are other things than like taking a doobie outside.
Very good point, which is how we use the marijuana is also changes what our body responds to it. So if we smoke it, it activates our blood vessels, causes inflammation. The edible forms are usually better. The absorption is variable. And whether you get it in a pill form or get it in a supplement can also affect the dose you're getting, because we know when you go to dispensary, they're not FDA regulated. You don't know exactly what dose of what you're getting. So it's really important, if you are going to try to use it, to talk to your doctor about how you can use it in a way that maybe gives you the medicinal effects without necessarily having some of those increased risks.
Yeah, because it saved some of my friends' parents' lives, or gave them at least 2-3 more months.
Right.
And it was a wonder drug for appetite.
Pain.
And for pain.
And it's an alternative to opioids. It is a game changer
for
pain.
Thank you for saying that. All right. DBL Nation, be sure to follow Dr. Kohli on social media at PyleKohliMD. Also, subscribe to our YouTube page for the latest science news and headlines. Thank you so much, Doc. Looking great in Christmas red, as always.